So you're a male, you work out, you're young, and you're having testicular pain or pain in the perineum or pain before ejaculation or after ejaculation. And here you are, haven't had pelvic exam and still with issues, and they're ready to inject you with things, put you on antibiotics, or who knows what. If that's your story, this video is for you. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy in Irvine, Orange County. If any of the things I already mentioned is what you're suffering from or you've experienced, the one thing you need to pay attention to is pelvic floor dysfunction. So pelvic floor dysfunction does not mean that someone, in your case, since you're a male, is going through the anus to have access to the inside of your pelvic inlet to see what's going on, or maybe even work on the prostate. That's one way to get to it, and frankly, at the end of the day, cutting all the BS out, you're at the mercy of how long that finger is. So you gotta understand that this is a lot more detailed and complex than just the internal musculature in your pelvis. There are a lot of things that play a role, such as your hip flexors, your lower back, the upper portion of your lower back or the lower portion of your mid back, your sacroiliac joints. These are the parts that are not being given enough attention to. As soon as these symptoms happen, it's automatically, in today's society, it seems, at least here recently, is let's go see a therapist where they can do the manual work. And I'm telling you, that is not going to necessarily be the solution or the complete solution to your problem. Your movement, your exercises, a lot of times these things happen as a result of doing the exercises incorrectly. A lot of times you're YouTubing things and you're doing exercises for your abdominals. You think you're doing yourself a great job, but when you do things incorrectly and you mechanically duplicate a movement that someone else is doing on YouTube, as an example, you can really mess yourself up. By increasing your inner abdominal pressure between your abdominal diaphragm and your pelvic diaphragm, and with whatever exercise you're doing, let's say you're hanging yourself from a bar and you're bringing your legs up, in your mind you're doing an abdominal work, when in reality what you're doing is your back is, you're either arching it too much or you're collapsing it because you're exhausted. So by increasing or by bringing the legs up, you're increasing your inner abdominal pressure, and at the same time it's almost like punching yourself in the stomach. So that bag, that cylinder, goes posteriorly. It increases an uneven spreading of the pressure on your internal organs, and it causes issues. These issues can be once again, compression of your internal organs. It could be an insult to pudendal nerve. It could be so many different things. I just wanted to bring to your attention that this is the one thing that you need to really have looked into. If you have any questions, please use one of the methods of contact in the description box to contact the office, and I'll be more than happy to see what is going on. Until next time, take care.